My name is Kyla, and I'm in a group with Sean and Nadine. We are arguing for the pro side of talk therapy should only be allowed if there are no effective medications. First, I will address some points made by the pro opening statement. Shall discuss how both talk therapy, also known as cognitive therapy, and medications are used together to treat disorders such as depression. He also stated how the two are used together even though antidepressant medication is technically the first-line treatment for depression. A study conducted by Robert DeBuse tested the different effects of cognitive therapy and antidepressants in patients with depression. It was stated that the current standard treatment is using medication to relieve symptoms and create a response that results in remission. This study also discussed how it is important to continue taking the medication even after their depressive symptoms are gone, because it is common for patients to relapse. Further research conducted by Stephen Holland examined the prevention relapse with cognitive therapies and medications. This study purely comparing how each therapy performed in relation to patients relapsing. It was found that antidepressant medications cuts the risk of relapsing in half. This was measured by relapse rates and calculated hazard ratios. The use of antidepressants had a ratio of 0.5. Holland's research showed how using medication alone is effective enough treatment for depression. Although talk therapy is not necessary for treatment of a disorder, it is necessary in order to diagnose patients. It is important for patients and counselors to establish a common ground and a safe place to talk about their issues. But once a diagnosis is formed, it is most likely to best treated with a medication specifically for that disorder. Once that medication is into effect, it should relieve the symptoms of the disorder, making it unnecessary to participate in talk therapy. I have known a lot of people with different disorders. Many of them take medications for the disorders. I have noticed that medications change characteristics of one's personality, decisions, and outlook on life in the manner desired. If a patient is on medications and participates in talk therapy, the effects on the drug may have been so drastic that it changed the patient's outlook so that talk therapy alone could lead the therapist to believe that the patient no longer had a disorder. It was also discussed in the con opening statement how there were cases where certain patients are unable to take medications because of negative reactions or cost demands of drugs. This prohibits some individuals of being able to treat disorders with medication. In this case, talk therapy is the next best option. And this concludes the rebuttal of why talk therapy should only be allowed if there are no effective medications.